A new finding from the National Academies of Sciences, Engineering, and Medicine finds that about a quarter of Americans 65 and older are socially isolated, and more than 40% say they feel lonely. COVID-19 has highlighted these issues, especially among seniors, and our Chloe Thibault is here this morning. She's been following this and how much of an effect loneliness can actually have on someone's physical health. Good morning, Chloe.
Hi, Sharon. Good morning. Yeah, research shows that prolonged social isolation and loneliness can have adverse health impacts comparable to smoking 15 cigarettes a day. It's a serious issue that's getting nationwide attention.
Every now and then I miss tactile sensation. I'd like to give somebody a hug.
84-year-old Beverly Kelly says COVID-19 hasn't changed her life much. She just misses her family and wants to hug the people she loves.
It's what gives our life meaning.
Eleanor Rennie is on the same page. She's 80.
I think you have to reach out to other people. Otherwise, you just get so isolated that it's not the way life is supposed to be.
On Thursday, the Senate Aging Committee held a hearing to discuss the importance of social interaction among seniors, especially in light of COVID-19.
If seniors are isolated for a long time and don't have human contact, that they tend to develop serious health problems.
Senator Collins says those problems include an increased risk of stroke, heart disease, Alzheimer's, and depression. When it comes to COVID-19's impact,
it's worsening the health conditions that are caused by prolonged isolation.
that's why seniors are encouraged to reach out if they're experiencing signs of social isolation, like feeling sad or bored, being withdrawn, or not enjoying their life. But the responsibility can't just fall on them.
Family members and friends need to make a special effort to keep in touch with seniors.
Because Mainers are resilient, and sometimes it's hard to ask for help.
I think people just have to realize that it's a time that you should be really good to other people that sometimes you just take for granted.
Now, a committee with the National Academies of Sciences, Engineering, and Medicine has come up with some solutions to address social isolation. Those include improving awareness among the healthcare workforce and the public about social isolation and strengthening ties between the healthcare system and community networks or resources. Live at home this morning, Chloe Thibault, News Center, Maine.
Thank you all for joining us again this evening for part 2 of our Being With volunteer training. It's wonderful to see you all. And for those who may want a little recap, when we spoke, what we spoke on yesterday, from everything that I've heard and some of the feedback already, I've been in touch with a few of you, so that's great to see. So thank you for that. Definitely reach out to us at the office if you have any questions. And if you need a copy of the book, again, there's a training manual and an actual workbook that we can send you via mail. So feel free to reach out to us via phone, call, or email if you need a copy of that. What we talked about yesterday and last night was reviewing our human needs. So our physical, mental, social, spiritual needs. Oftentimes with physical needs, we have to counter and also, keep in mind often that there's basic needs like sleep, rehydration, medication, making sure that a person has physically what they need in terms of stimulation as well. Mentally, if a person happens to be perhaps not stimulated enough or feels like they don't have a challenge in their life or something that they can work towards, a project, accomplishment, even a task of sorts, playing a game or playing cards, for example, that's a really good way to mentally stimulate someone. Since last night's seminar, I actually received an inquiry about a woman, and thank you for that, for ideas on how to keep our family relatives stimulated if they happen to be going through something like dementia or Alzheimer's. And that's a great question. And so I'll share some of this information with you. Some ways that you can actually help your loved ones remain mentally and cognitively alert is to do various trivia questions. One great way to do this is there's an online YouTube channel that offers physical activity. So it actually has an exercise component. So you're sitting in your chair like we are now, most of us are sitting down, and you would simply be moving your hands while you hear trivia questions being asked to you, and they give you a little bit of time to answer those questions. So it's a really nice way to combine mental alertness and cognition with physical ability, strength, and working out. And that you can look up, or you can send us a message and we can send it to you in our follow-up actually. So I'll include that as a link for everyone. Socially, we definitely want to remain in touch with our loved ones and friends, and especially if you are part of a group in a community setting, you know, people or members of that group may have grown further apart and distant perhaps to their involvement in any type of organization. So it's very important to be involved with them in their life again. Now that COVID is really behind us for the most part, we can move forward and re-invite those people into our sphere, into our life, and especially into our world. And this My Story program is a great way to do that. And that's why we bring that up. When it comes to spiritual needs, oftentimes we'll see that people will ask or request there be a spiritual component to their visits. For example, someone is able to pray with them, or perhaps say a specific prayer, or be able or available to be in a spiritual presence with them. For example, meditation, or simply listening to music. Depending on the person, there are different ways that you can express, or they can express, their spiritual needs. So part of that role with you being with them is actually to help them express themselves spiritually. And that's really beautiful. And that helps to complete all of our human needs. And if one of those is really not in place properly, then the rest kind of fall as well. So we definitely want to reinforce all of these needs and make sure that the full, complete person is acknowledged in our visits. Another point we mentioned yesterday and last night was visiting advice. So we shared with you making sure that when you're managing your visits is getting in touch with a parish, or for example, if you're in a community, starting that communication in order to actually have visits completed, to have a team member or a person, a partner with you. Going into visiting with another person is very helpful. Why? It protects you, it protects the person you're meeting with, and it also enables you to have a better experience, a wider glimpse of the visit itself. And that's really key. Another thing to keep in mind is to have a vulnerable sector check, or a police check, for example. So if you're part of an institution or a group, you're walking into that situation in that visit with the proper background work done. And that makes the person you're seeing more comfortable, and it also helps you in terms of other issues that may come up. When it comes to visiting, you want to ensure that you obviously are as polite as possible. We treat everyone as we would want to be treated, which means we keep the right, appearance, the right perspective. Obviously, we don't need to wear cologne or perfume perhaps, and especially if we know there might be sensitive. So things like that are some things to keep in mind. Obviously, we're knocking on the door, making sure you acknowledge you're walking into someone else's living space. If they are someone who is sharing a space, that you are allowing the other person to know that you're there. And obviously, completing that visit with a sense of well-being, genuine hospitality, any type of consideration that you would give yourself or anyone you love, you would want to do that same in their regard. And then obviously finishing the visit is really key, because you want to complete the visit on a great tone. And if you can make notes in a journal. Alex and I mentioned that yesterday. Journals are really handy and they're beneficial because they actually help you remember what happened during the visit, so that when you visit again with them, you can recollect some of those thoughts and actually have those notes. Oh, avoid this discussion, or this type of maybe this type of conversation, because that might flare up some or trigger some emotions that they may not necessarily appreciate. So that sums up my part of the review of day one. Maybe Alex, if you want to touch a little bit as well on My Story Matters. Thank you.
I spoke about the My Story program and the idea of the importance of the My Story as first of all being an opportunity to have an open access. Someone might want to talk to you because you are seeking their story, you're seeking their history, you're talking to them. But the biggest thing about the My Story is that it affirms the person. when you're talking to somebody about them and their past and everything, that affirms the person. So give you just a very quick example. My wife and I just visited my aunt the other night, and my aunt has got some significant health problems, so she can't get out at all anymore. But she's gone back to something she did in her childhood. As she talked about, she has not done this since she went back to painting, and she's actually very good at it. But anyway, we dropped in to see her because she was saying that she wanted to paint something for us, and she had done so. But the thing is, then when we sat down, my aunt wanted to tell stories. She wanted to talk about the past, and she had grown up with my mother, so she has all these stories. So anyway, it made her so happy. So we sat and listened, and she spoke. And the My Story, in this case, we weren't asking her questions for the My Story purpose, but she was talking about herself and what happened in her childhood and in her younger years. And that really affirmed her now that she's so much older and losing her ability to do many things. The other thing about the My Story is that if you're in a community group, of course, it's if the person gives you permission, you can use that story, and you can then build the history of what your church or your group or whatever it might be. And I think that's very important when we're looking to our future, that we have a past. So the first, so I'm going to just say, and the quick introduction is because this is not the topic I'm going to be speaking about, but when we're communicating with people with disabilities, a lot of older people, they've acquired disabilities over time. So that's why it's so important to talk about this topic.
Thank you so much, Alex. That's great. And yes, I'll continue from here. I think it's important when we're speaking with someone with a disability. I, for example, am married to someone who has a disability. He has a visual impairment and is considered legally blind. And so we have oftentimes it affects, our day to day, because there's certain things that I have to keep in mind, and I have to often remind myself that I need to do this and I need to do it in a certain way, or else, it might not agree with my spouse. God bless him. So we are speaking about communication for now. This is a really great point and topic, because oftentimes when we speak to people who may have a disability, you may not be aware of it, first of all, what kind of disability they have. It took a while for my husband at the time when we were courting or dating to actually show me or identify that he had a disability. I kind of picked up on it, but I wasn't sure on what it actually was or what was the cause of it until he actually brought up. And that may be the very same case for you when you come into a meeting scenario with a person that you're visiting with. You might find that they don't want to disclose their disability, and it might actually be very apparent to you that is a disability. So definitely not making assumptions for that individual is key in this sense, because we don't want to assume that they can't do something completely, because they might be able to partially be able to do certain things. So that one point that brings this in here is that we don't want to make decisions for others. So for example, if you believe that a person is not able to see something, taking on more of a role for him or her to see something or to bring it closer to them, for example, in their face, is something they may not necessarily want or need. So not making decisions about participating in any type of activity is really key here. If you want to help, they will ask you. If they want your help, they will often ask you. And if they do not want help necessarily, then obviously you're going to remain without acting. And so people with disabilities are the best judge of what they can or cannot do. And that's really important here. We always want to ensure that we are speaking directly to that person. So as I'm speaking and my attention is on you, I definitely want to do the same to anyone who I'm speaking with over the phone or, in person or on Zoom. My attention, my regard is definitely on you. When you're speaking with them, you don't want to speak to their interpreter. If there is a translator or interpreter in the room, you want to actually speak to the person who you're meeting with. And this is important. One example of this is just recently when I spoke to a woman we're working with. She said that when someone she met with as a home care provider came into her home, she was assisted with an administrative person. And then between the two of them, they were speaking, to one another. And it was like this chitter chatter back and forth. And she kept feeling the need to say, "Oh, excuse me, what are you talking about? What's happening? What are we doing here?" And because she was not aware of what they were saying, she felt really disempowered and felt very, almost you could call it, shut out and perhaps disrespected. So I think it's really considerate of us to always keep in mind that people do see how we behave with others in the room, and making sure that you behave accordingly when you're with someone. Obviously, this is, common sense, human nature, but sometimes we may actually think we are helping them by speaking to someone indirectly quickly to get a job done or a task completed, but that actually is maybe potentially creating a disregard for that individual in the room who we're trying to assist. So always speaking to them directly is key here. And also, if you are speaking or having to speak to an interpreter, to speak to that person first, and then having the interpreter hear what you're saying and speak to them directly is key there as well. With anyone who has a disability, we definitely want to avoid any negative or disempowering words. And for example, victim or sufferer, we want to be very sensitive about this type of language, because like I said yesterday, if someone has a wheelchair, we wouldn't refer to it as wheelchair bound, or someone who is disabled with a wheelchair. We don't want to use that kind of language with someone, especially because that chair, especially if it's a wheelchair, that may be their only way of being mobile. And that is an enabling form and act, and actually a device. So they might have very high regard, and that's why it's so important for them to have that. And definitely we want to be able to do that as well, and have that same regard for their property and what they use to help them. Excuse me. When we're talking about physical contact, definitely we want to ensure that we are sensitive about physical contact. Now, another key point or key example would be if a person is brought into a home and they're going to give someone a bath, and that person is not comfortable with them touching them because they don't see them in that regard, or they don't feel that they would be best suited for that job, they may refuse that contact completely. And that's really important too, because that is a sensitivity. Everyone will have it. Obviously, if there's physical contact involved, you're not doing or performing those actions, but just keeping that in mind is really helpful, because oftentimes people don't realize how sensitive people are with their own body, or even with their own physical space. If people are coming into a space, and you, for example, are coming into someone else's home, we will definitely want to ensure that we don't move any of their items, and that's really important too. Physical contact of their objects, but also with them, is important here. And obviously too, we want to make sure that we are speaking of when they're speaking and you're speaking, to be in a quiet environment. So I, for example, have a window open at the moment, and I hope you don't hear it. So thumbs up if you don't, but there might be an airplane passing through, and I live right under an airstrip. So they like to keep their course right on top of our home sometimes. But if you hear that, or if that's bothering them, then you may want to relocate and actually move your visit to another place. So the same thing goes always across the board, is do unto others as you would have them do unto you. And that's really key here. And that's our golden rule that we want to make sure everyone follows. And so the next point, when we're bringing up, for example, with people or persons with with a disability, for example, or they may be on a spectrum like autism, this is something that we want to avoid, is, for example, using language that is sarcastic. So for example, people may not necessarily understand that if they happen to be on the spectrum. And so you want to avoid things like sarcasm or a certain figure of speech. I had a friend once that I didn't understand it. I didn't think he was on the spectrum, but he might have been, or he might have not completely. But I said a figure of speech saying, let's take it out and put in a doggy bag. He didn't know what that meant. And he actually looked really puzzled. And I said, a doggy bag. And he looked at me again, and I looked at him, and he looked at me. So it was one of those things where you assume one thing, but you don't want to necessarily, because people may not know what you're talking about. And so, we had to explain that. And then, we moved on. So figures of speech or certain colloquialisms are important here, and we want to avoid using certain things like humor sometimes when you don't understand perhaps one another as well as you think you would. So that can be something you can avoid. Definitely using short, simple sentences are really helpful across the board. And I often have to remind myself is to slow down and to talk in short, simple sentences. I don't want to assume anything from anyone anymore because oftentimes that might be the wrong understanding. So I definitely take notes, and that's what you'll see me doing a lot now, is taking notes on what people say, because you don't want to have to repeat yourself or ask them more than once. That can draw frustration, right? Great. And so the next thing is oftentimes we need to offer closed-ended questions. For example, would you like to go outside for a walk today? Yes or no. And you want to close that question so that there is a definite answer and maybe not really room for misunderstanding. If they are speaking to you and the way they are showing their body, be aware of their body language, because that sometimes is not well understood. Oftentimes someone may have they might be crouching down and holding themselves. They could be in pain. They may not appear to be in pain, but they actually might be experiencing pain at the moment, and they just don't want to complain. So they're not saying it to you, but just being aware of that and how they appear to you is very important. And also body language, if they're fixed. I have a baby, a newborn. He's 3 months old, and I brought him into the office the other day, and our accountant actually brought this up. She's wonderful. She said, look at his hands. They're like this. And it's true. He was like this. And the reason is, he was hungry. And so once he started to eat, they started to open up, and they were starting to hold on to me like that, which is really nice. And it's an absolute true sign always that, people are expressing themselves with their body, with their face. So just be aware of that. For example, with the elderly, we definitely, when we're visiting with someone, we don't want to treat them as a child. And especially if they may be on the spectrum, you want to ensure that you are using flexible words. So for example, instead of saying, we're not going to do this today, you might say, we may not be able to do this today. It depends on how the day goes, so that you're not being an authority figure on them and speaking down to the person, because that's really key. We don't want to do that and mislead people and make them feel less than while we're speaking with them. One thing we can mention too is the next point is we're speaking with people with chronic medical conditions. Thank you, Alex. Excuse me. With someone who has a medical condition, we want to be calm. And that's something I have to always work on, making sure I'm not hurried or really pushing through to the next task, because I'm a doer and an action person. But I definitely need to slow myself down and ensure that a person that's with me, like everyone here on the call, I see, people moving around in the background. It's beautiful. I love action, but that's not everybody. And that's not the case for everybody, and to me, I love when someone is able to, explain something once and they understand. So I try to do the same thing, and I definitely want to be in an unhurried tone. If there is something that a person needs and they have a condition, sometimes, they may ask it once and they think you'll remember. Again, memory, not my forte. Maybe it is yours. Great. I find I need to write notes in big, bold letters and highlight. And if they, for example, need a drink of water every hour, then that's something they might ask you, and maybe be available for them to do that. Okay, that's just a suggestion. That's a great thing, especially with that hydration. And now, because we have the summer months coming, it's literally something I forget all the time, that we need to stay hydrated and work on our drinking and making sure we're always replenished. In terms of support, someone who has a condition, you can ask them if they need help. If they do, they'll ask, they'll may ask you, they may not, but definitely ask if you think it's a good thing that they might appreciate. And definitely always make sure you tell them what you're doing before you do it, because that's really key. You don't want them to feel that you're assuming something of their inability, or, assuming that you're going to do something that might hurt them. Always first case, people are looking to preserve themselves and their well-being. And if someone else is infringing on that, that may also cause a disturbance in their life for the day or the week. So we don't want to do that and avoid anything that can hurt them. Excuse me. If someone is having difficulty in hearing, so if a person is hard of hearing, again, this is something where I find it really pertains to my family, because we have loudspeakers in our family. And it's nice because I can hear people well, but sometimes, they might not hear me. So I would love if someone is having trouble hearing, definitely let them know if you are having trouble understanding them, because that way they can actually respond and act accordingly. They can raise their volume, or they can move to a different location with you, whatever it may be. If you have, or if they happen to have an interpreter, definitely maintaining eye contact, like I said before, with the person who is hard of hearing is important, in letting the interpreter hear your words and just respond accordingly is really key here. Okay. Sometimes we will often see that people will talk to the interpreter because they want to be considerate, but this is the actual thing we want to avoid. We want to speak to the person who is hard of hearing so they can hear you speaking to them. And definitely letting people know that you can rephrase something. If you have to, you may need to say something multiple times in order for someone to hear your genuine concern, or something that is important for them to understand. So definitely rephrase sentences that they may not understand. Cognition, hearing and cognition, you sometimes think are related. Obviously, if they can't hear you, they won't understand you. So definitely making sure you're aware of that is important. People will often do this a lot of the time, and they just want to move to the next thing. So again, saying yes, 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 maybe let's talk and go back a moment and see if that everything was understood, what we just talked about, because things are sometimes left misunderstood. If you're talking to a person and you're in their actual face, maybe definitely making sure that there's no light source behind you is key, because sometimes when you're speaking to someone, you might be in front of a window, and that light's coming right in, and they're looking at you through that light, and it's hard on their eyes. So this may affect their other abilities. So definitely just keeping that in your mind is really, really important. And so don't sit in front of a light if you can avoid it. And making sure also that some people, if they have an issue hearing you, you may want to speak clearly and slowly. And what often people don't realize is that some people who have a hearing loss issue will actually count on watching your lips as you speak so that they understand you, and that'll help them understand what you're saying. And so avoiding chewing gum or obscuring your mouth, a mask these days, if you're deciding if you have to wear one or not, ask the person if they prefer it, because that can make things even harder, perhaps, right? So definitely, keeping that in mind is important, and definitely not yelling, because that's something I know my family likes to do. They will raise their voice often, but we don't need to do that if it can be avoided, obviously, and just keeping the volume lower. It's important. So
I was just
Mhm.
Sorry, I was just going to say that when we're visiting older people, this is something you're going to see a lot, because of the fact that as people get older, some people, whether it be a family degenerative issue or whatever it might be, they start losing their hearing. And certainly I've certain farmers in our family who, as they got a little bit older, because of the noise of the barn and things like that, over the years, they started losing their hearing. But now you're trying to communicate with them. So this is more of a common thing you might bump into.
Absolutely. Yes, that's so true. So true. And those loud concerts that we all went to, right? Back in, the 90s or 2000s, whenever. So I had for example, when we're speaking to someone with a hearing difficulty, if you have trouble hearing someone, let them know. Definitely. Older people, they may have acquired, a hearing difficulty later on in life as well. A lot of these disabilities might have been acquired, like Alex said at the beginning. So it's hard for them to recognize when they need help or assistance, or that they don't even understand what you're saying at the moment. So it's just good to keep on top of what you're saying, and that they acknowledge what you're saying. With someone who happens to have a learning disability, this is something that we want to also note here, that they might have acquired this later in life. And so what that means is you may actually bring some supplies with you. So for example, if you're speaking to them and you have a notepad and a pen, that's really helpful here to allow yourself to draw or to show an artifact or something that like you're speaking about, in order for the person to understand what you're talking about. Sometimes you may, again, come back to using short, clear, direct sentences, because that's going to help them understand what you're saying and not be vague or general in your terms and what you're using. Definitely rephrase whatever information you think might not be understood, or present it differently in 2 different ways. So you can say, you can draw a picture of what you're talking about, or you can show them on your phone, for example. If you're referring to something, people will often find that's really helpful, because they're going to see what you mean quickly and effectively. Like a picture is worth 1,000 words, right? So you can really just pinpoint what you mean right then and there. Using visual aids, again, taking them to what you need them to know about is really important as well. And so another thing is to offer opportunities to answer questions. So if you need to rephrase something or explain in a different way, definitely think of that and keep that in mind. So thank you, Alex. And if a person is, for example, has a mental illness, this is something I find is one of the most difficult disabilities that you can work with, because they may not express themselves and tell you this, but you may find it's a long kind of revolving and kind of evolved form of understanding. And you might realize you've got them understanding, and you understand exactly what type of person or what state they're in, and then all of a sudden they'll switch on you. So something will come up or flare up for them, and then all of a sudden you're back to square one. So definitely remain calm. Always remain calm. And this is a lesson in patience, which we're all learning. So definitely I have to remind myself to remain calm in any situation. If the person's blaring at you, if they are raising their voice, or if they happen to be argumentative, or they want to push back, or they have brought something up that you feel is triggering you, definitely remain calm. And it's that irony of, when they go up, you go down. So balancing up the situation is definitely going to help you here. It won't hurt you, that's for sure. And then, if all else fails, you can just pray that things start to look better, because that's all you need sometimes is a prayer. And if sometimes, you're speaking and the person is not getting out what they want to say, they just need to talk it out. So sometimes they want to vent and they want to unload, and that can take time. So put away the book. In that way, you'll just hear them out, and that way they don't feel that they're there under the gun, waiting on a time that's afforded to them. Because oftentimes with especially older people, they want to just vent and put it, out, and that's it, and let it be, off of their chest. So definitely show empathy, show that you care, understand them. You can, if a person is showing signs of agitation, anxiety, or panic, fear, you definitely want to remain calm, like I said, and say things like, I understand you're feeling this way. I appreciate that you're sharing with me that you do not like how that person spoke to you, or how your mother carried that situation forward, however it is that may have evolved. The point is you're listening, and you actually are there for them, and you are having an opportunity for them to vent and get out their frustration. You may be the only person they talk to all week. Like I said, and how Alex showed you yesterday, that video is really important. People have different experiences. A mental illness that you may come across too is that their reality is different than what is actually happening or transpiring in front of you. So for example, if someone has a hallucination, or if they're schizophrenic and they may have a delusion, those actual delusions are real for that person, but they're definitely not necessarily real for you. So don't pretend that they're real to you. Just simply acknowledge that that person is going through something, but don't convey that you are there with them going through the same thing, because obviously that's not the case. So again, bring back to reality where you are with them at that moment, and using clear, short sentences saying, I appreciate how you're feeling. Let's look at this over here, or try to change the direction of the conversation to something that will bring them back to the reality that you're both in. Okay. Definitely, if you find that you need the support in those circumstances, definitely allow someone else to come in and give you support. So if you have a caregiver that they're working with, and they're in that same proximity or room, call on them to help you, because you may need it, and that's perfectly fine. We're not in this alone, and we're not going to stay alone. So we definitely want you to have the support you need. And if you are going to be asking someone else for some assistance, definitely tell the person that you want to ask for some support. You can tell them what you're doing, and that way they feel informed, that they know what's happening as well. Okay. And the next point, who may have, thank you, Alex, a mobile issue. So if someone has a mobility issue, you know, the people have many needs related to their mobility. And for example, a person with a respiratory or heart condition may have trouble walking, and a long distance or even a quick walk is something that's really out of scope for them. So that is something I often rely on, and I'll say, hey, by the way, you know, why don't we go for that walk, you know, Joyce or whoever, and simply saying something to them that is overbearing or too difficult will actually trigger them. So we don't want to assume that they can do something. We definitely want to allow someone to, you know, offer a suggestion. So, hi, Roberta, how are you doing? How do you feel today? Oh, great. Would you like to do this or this? Oh, perfect. Fantastic. Let's do that. And you're suggesting to them, we can do this, or we can take the course in this direction. And what's really nice is that a person who may have a wheelchair really would appreciate, especially someone like you, if you are speaking to them, to refer to that wheelchair in a positive manner. And it's so counter what we find cultural, because we think it's something that's they're bound to, but they're not actually. And it is something that's positive, and it's affirming to them because they're able to participate in things and get around because of that wheelchair. So if you come in right off the bat, reaffirming them in that positive tone towards that wheelchair, that's actually going to probably impress them that, wow, this person really knows what it means to be in a wheelchair and how I have to live with this or how I have to adjust to this. So definitely, if they are in a wheelchair, you want to sit at their level. So if we're sitting beside each other, I'm not going to go above them and sit on a bed that's higher than them, so I have to look down. Or I'm not also going to sit on a stool where I have to squat and look up at them and makes them uncomfortable and they have to look down on me. So you definitely want to assist them and yourself to be at the same level wherever you are. And also definitely be aware of what their reach and their limits are. If they're not able to grasp something and you can, ask them if you can help them and assist them in grabbing something for them. If they happen to be in a wheelchair and they need to move, don't push or touch their wheelchair ever without asking them, okay? Because again, that's an extension of them. And so you don't want to assume anything there and take you know, their own property away from them without them knowing, and definitely ask them ahead of time, okay? It's part of their personal space. So we don't want to assume anything with that. And now, just speaking on speech and difficulty speaking, we often will assume that everything that we're saying is being understood, and the tonality we use and the volume and the expression is all great. Well, sometimes that's not the case. So we have to be aware of this and not assume that they can't understand us, but that we have to obviously afford them any patience and all patience that we can. And don't interrupt or finish the person's sentences. I know that's something that I used to do. I dropped that many years ago because I think it's really it's not necessary. So thank you so much for assuming what I think I'm going to say, but if you're cutting me off, I probably won't like it. And they might not like it either. So thank you. We definitely want to be patient again, and making sure that any type of questions that we ask, they require short answers. So if it's a yes or no, great, feel free to use those. Would you like tea? Great, yes or no. Would you like cookies? Yes or no. Would you like to go outside? Yes or no. So those things are really good, because if a person has difficulty speaking, they will have an easier time saying a short answer versus, you know, a belabored response. And what's really key too with this is having an appreciation for a person who's unable to respond when they need to, for example, associate what you're saying and then speak through another machine or something else, which can happen as well. And obviously being attentive to their difficulties is really key here. Don't pretend to understand, and ask to rephrase things if you need them to be rephrased. And always be open to different ways of communicating, because like I said, you can bring a piece of paper, a pad with you and a pen, and just jot down what you want to say if you don't feel they are understanding your speaking. Okay. Great. And then the final thing is, when we're speaking to someone with a visual disability, you know, you definitely, if you come into a room, you want to identify yourself. So if knock, knock, I'm here. It's Kathy Matuzzi Acosta. I'm meeting with, Marion, and I'm looking forward to seeing her. So if that works for them, if they can speak in that room or that setting, that's great, but maybe they want to move places. So just identifying yourself. If they happen to have a dog that's helping them, like a guide dog, then that's great. Just making sure that you're actually on the opposite side of the dog is really important, and try not to interact with the dog too much, because it's not about the dog, it's obviously about the person. So we want to make sure you're on the opposite side and don't touch or interact with the animal if you don't need to. And definitely make sure that you describe what you are doing. I experienced this today actually with a lady. We just spoke to a follow-up to a visit that she had, and she said that some things were moved around. So in her apartment, when someone came to her home for a visit, and she was very upset by this because she had to spend a long time after that to rearrange things, to find things and objects to put them back where they belong. So I appreciate that that person is giving that feedback, so I can relay that back to a person who's giving her care. And also, if you happen to do something, definitely describe what you're doing. And if a person, for example, is looking to, like if you're going for a walk and they have something like a stumbling block or something's going to be in their way, just let them know about it, because you're giving them that heads up. They'll appreciate that. And for example, if you're outside and you know the person might be have a visual impairment with, for example, long distance, I often will bring up, oh, look at the sunset. It's really beautiful. These are the colors, or this is what's happening over here. And they'll appreciate that too. And definitely giving specific non-visual information is helpful here, because if a person happens to be blind, and they happen to be eating with you or in front of you, then let's say they have a garnish on the plate, you can actually tell them, okay, there's a piece of garnish, to your, at your 12 o'clock location, and then simply let them know that, so that they not necessarily have to eat that or that gets in the way, right? So just certain things to keep in mind that you would appreciate if it was you as well in those shoes. Or you can simply remove the garnish as well, and that's another option. Definitely you want to give an opportunity for people to, if you know or realize that there is a visual difficulty, you can read information. Like I said, for my husband, oftentimes he is not able to see fonts that are anything less than 16 size fonts. So it has to be, much magnified. So on the phone, if you're looking at text that's normal, okay, that you think is normal, he would have to actually look at that, and it's about 300-400 times that size in order for him to see or read that. So I often will read things or offer to read things for him, and the same goes with someone who might have a visual difficulty. Offer to read the information, and this is actually so really highly appreciated when someone has a visual disability, for that someone to even come by once a week and help them go through their paperwork, help them go through their mail and read certain things to them. That's really cute. That's really amazing and courageous of you to do that. And it's beautiful to see oftentimes, because people don't have that experience usually. So definitely think of that or keep that in mind. And definitely, if you are sharing something with someone, keep the print as large as you can. And that way that person is able to appreciate and see what you're trying to show them if they're going to end up reading it. And if a person is leaving, or you're having to leave this meeting or a visit, definitely ask them if there's anything you can do for them before you leave. People who, as they age, their vision may become impaired, and they may not want to ask for things, but it's always nice for you to suggest if you can help them in any way before you leave. And of course, keeping that in mind and keeping that for the next visit is really great. So thank you so much. Perfect.
Okay, can everyone hear me fine? Perfect,
Yes.
Excellent. Okay, so I'm going to be talking about advocacy, and now I moved my slide too far. Perfect, here we go. So advocacy is not for everybody, but it is very important, especially if you have a family member. So I was talking about advocacy recently to someone, and they talked about what happened to their father when he was very sick. And this was this man's son who I was speaking to, and he spoke about the importance of the fact that he was the advocate. He spoke up for his son, for his father, I mean, and helped out in a serious way. But when you're visiting someone, You may or may not be comfortable with becoming an advocate, but we, with Compassionate Community Care, have now developed an advocacy program. So I'm just going to give you a bit of an overview of information, but in the future we'll be offering training in advocacy also. Now, why is advocacy so important? Well, I'll give a couple reasons why right off the bat before we go into the information. When you're visiting a physician, for instance, and you might be very elderly, a very elderly person who's got several health issues, the doctor is trained to try and heal. But you have now, if you've become older and you've got several health issues, you're not actually healing per se. This is now how you are. So you're looking at different things. You're looking at ways to deal with certain, let's say you have certain pains, certain issues. Are there things you can do to make that lesser? Is there things you can do to treat that? And you're looking at all these different issues, but it's a different mode when you're dealing with someone, for instance, somebody with a disability. People with disabilities always complain that they have to fight for their medical treatment because the physicians have a hard time understanding them. They're different because it's not that they have a condition that's going to get better. They are in this condition. This is what they have. This is how they are. And they are looking for ways to make sure that their life is the best it can be. So you're finding with advocacy, it's important when you have someone who's got health issues and things like that, when they're visiting a physician, have somebody with them. And there's a couple of reasons for that. The first reason will be right off the bat, you're helping that person state their feelings. You're helping that person talk about their pain, their issues. You speak to them ahead of time, right? So you're helping them express themselves to their physician. But you're also significant community to that person. Now, what do I mean? If someone goes to a doctor and they're alone, the doctor doesn't know that person necessarily. They may not have never seen them before, the doctor or the nurse, that is, because often we see nurses today, nurse practitioners, et cetera, not doctors. But nonetheless, they may have never seen you before. They don't know who this person is, right? But they do know if there's somebody with them, that they have significant community, that they are important, that they have people who love them, and they see them differently. And I'm not saying that that's a good or a bad thing. I'm just saying it's a bit of a reality. That's what's going on. That's how people look at things. Some people are afraid to speak out. You know, they might go to the doctor, they've got issues, and they don't know how to express themselves, or they're afraid to talk out how they're feeling, or maybe they're having difficulties with communication. So therefore, you have talked to them ahead of time, you're going with them, you have agreed to be their advocate, and you're helping them receive the treatment they need. There might be a situation where they communicate differently. So for instance, if you come from I would just say a community of new Canadians. So let's say someone's parents never learned the language well, and it's important then that someone who knows the language well and knows that person well also goes with them to the doctor, etc., to ensure that they're being understood, right? They may be also too ill to speak up, and that's very important. Someone is speaking up for them. A support person can help that person, what? Stand up for their rights. You know, we talk about the importance of our treatment, our being treated with equality, etc. I always talk about these things and say, well, let's put this in the position of the medical caregiver who has somebody and they're having a hard time figuring out, well, what am I going to do for this person? Well, you've already discussed it with them ahead of time. So you're helping them stand up for their rights and to receive the treatment that they need, right? Something that's of benefit to them. You obtain opportunities for them. So what is this situation about? Well, let's say someone needs some home care and they don't know how to advocate for themselves. They don't know how to speak about it. They don't know how to express to the physician that really, I can't do certain things anymore. I really do need a couple of hours a week of help. And then you as an advocate would make that very clear that so-and-so with their health condition really at this point can use a few hours a week of help. The physician is a bit of a gatekeeper in the system. If the physician is advocating for that, it might happen. If the physician is not advocating for that, it might not happen. So we gain access to support and services for that person, and we talk with their healthcare providers. So we help express what the person is going through. Now remember, an advocate is representing that person. So everything that they are doing is for that person, not for themselves in any way, and everything must be confidential. Some people can't be an advocate because they're not capable of keeping everything completely confidential. All the information that you're dealing with is that person's information. Unless that person is willing to share it with somebody, it doesn't get shared with anybody. How to be a good, well, you have to be a communicator. The best way to be a good advocate right off the bat with communication, I always talk about the importance of being very polite. Well, here we say courteous and respectful. When people call me about situations and they'll say, well, this is what's happening to my mother right now, and I'm my mother's power of attorney, and the doctors won't let me see my mother, and they've barred me, and I'm getting these terrible stories about what's happening, and they're really concerned about the treatment that their mother or their father's receiving or their friend is receiving. The first thing I say to them is, well, if you're their power of attorney, you have the legal rights. You must always be straightforward, but you must be so polite and so respectful to the doctors and nurses that sometimes it even hurts. Now, why do I say that? Well, because as I already said before, the doctor, the nurses, they are trying to do their job, and sometimes they have, how would you say, there's a sort of, how would you say, there might be an attitude that's developed within that community of caregivers. So there's a bit of a way of being. So maybe you have stepped on their toes by how you spoke to them, and suddenly they don't want you around. They are the gatekeepers. They can say you're not coming around anymore. And it's very important that we always are straightforward, honest, respectful, and we are talking to them in a very clear manner, but never upsetting the caregivers. We must be a good listener. We must listen to what's going on, and we must ask questions. Now, asking questions, you could say, oh, well, you know, this person asks a lot of questions. Well, I mean, asking relevant questions at all times, because if we're talking about the care that someone's needing, it's not good to make statements. You know, I read this on the internet. Why aren't you doing this? No. No, the way to handle it is you ask questions. You start, you know, because with the answers you get from those questions, that leads to maybe the better care that that person's going to receive. You must be a good communicator, obviously, to be a good advocate. Discussing expectations is very important. So when you're talking about arranging consent to be a caregiver, to not, in this case, be an advocate, you must know the expectations of the person you're representing. So if the person is going through some certain health problems and they know that this is a chronic condition, they know that this is continuing, maybe what they're looking for is ways to cope with it, or they want to try and find ways that their pain is being dealt with in a more effective manner. There might be different things, but you must discuss these expectations because you're representing them. You must be comfortable with that person and be a comfortable advocate and be willing. You must have written permission. So in our booklet, we have a copy of a permission form that could be signed, giving you written permission, because you need to be that legal advocate so you complete the advocate agreement. And it's important that we do this in a way that we recognize that we're taking on a legal role when we become an advocate for somebody, okay? Being an advocate is also a little different than being their power of attorney for personal care. Now, why do I say that? Power of attorney for personal care is a legal, it's a legal comes into place when you become incompetent. So for instance, when someone becomes incompetent, if they've named someone to make medical decisions or care decisions for them, then that's at that time that comes into place. But while you're competent, there is no issue. There's nobody else who will take care of these things. You're the one. So the difference between being an advocate and a healthcare proxy or a power of attorney for personal care, or being someone in charge of an advanced directive living will, whatever you want to call it. There's so many different names depending on the jurisdiction you're in, right? I often, when I'm doing this talk, I get people correcting me. No, we call it this. And I say, yes, in Ontario, we call it the power of attorney for personal care. And in Alberta, you call it this. So, you know, there's different names. But with the advocate, these people are still competent. Now, I'm going to say something about healthcare proxies. The Euthanasia Prevention Coalition does sell a healthcare proxy document for $10. It's very cheap, but it's probably the best document. It's the best $10 investment you'll ever make, because it's designed to protect you. And what's important is that you make decisions about your healthcare that are going to protect you, but you have to understand the language of that document is everything. I get calls all the time from people, and they say, well, you know, my mother's power of attorney for personal care document that she signed with her Catholic lawyer, it said this and this and this and this, and that does not fit what she believes. But now that she's in this situation and I'm the power of attorney, the doctors are saying to me, no, your mother had wanted this. And I'm thinking, no way. Well, what happened is she obviously signed a document with language in it that she probably wouldn't have agreed with if she knew exactly what was in the document, right? So I always say it's important to have a document that protects your life. And you can email us at info@epcc.ca and we will send it to you. It's $10 plus tax, comes at $10.50. That's a cheap way to protect yourself. Anyway, in the case of advocacy, you're dealing with someone who is competent. I'm going to make one final comment also about healthcare proxies. You know what's interesting about healthcare proxies and power of attorney documents is a lot of people who are in a nursing home are fully competent, and yet they have signed their power away over making decisions for themselves to a family member or a friend. And I think that's ridiculous. I think that's dangerous. You don't do that if you're competent. It's when you become incompetent and you can't make decisions for yourself. So why am I saying this? Because then what happens is that other person now has legal power over them and decisions are now being made by another person and you lose the right to make decisions for yourself. That's not a good thing. It's just simply not a good thing. Before the visit. So when you go to a doctor and or how would you say some medical visits with that person, you must know, of course, what the time of day is going to be. You must gather information. You must bring a list of medicines. You must inform the doctor's office of your role, because if you show up, they're going to wonder, who is this person? You have a role, you have a legal role. You must be prepared that there might be a delay. I don't know if you've ever gone to a doctor's office and there was a delay. Probably you have gone to a doctor's office and there was a delay. Anyway, you must be prepared for that. But why am I saying this? These are all important information. You gather information. When we're actually talking about gathering information also, you talk to the person who you're representing and you find out, exactly what they're feeling right now. Because it's possible that they are having health issues and they're having a difficult time explaining it. They'll have a difficult time explaining it to the physician based on maybe they're having some health issues related to how they're communicating now. It's possible they're having a bit of early dementia, meaning that it's not significant, but they're having difficulties. So you having that discussion ahead of time, gathering information, you are going to be prepared to help the person. So what do we need to accomplish? Well, we need to know what the person's concerns are. As I've already said, this is very important. What medications? So obviously, if you have the medications list, you can ask the physician, can you review the list? Because the person here is, Mary is having difficulties, and it's possible there's some, like she's got 12 different medications. It's possible there's some side effects that are affecting her, and have them review that medication, or certainly if you go to a pharmacist, that's another good thing to do, have them review the medications. Do they want to discuss new symptoms or concerns? This is an important thing. They might be having different things that have just started. How do you talk with a doctor about sensitive issues? It's very important that when you're talking about sensitive issues, that this is seen as very much of a complicated thing, because you're talking about somebody's privacy, and yet at the same time, you're helping them express themselves, okay? Because you're doing it for them, with them, okay? Your presence may be support enough. I always recognize the fact that people view you differently if you have someone who goes into the doctor with you. So a prime example, again, is the person that we were talking, Kathy and I was talking to actually the other day, and he was talking about his dad when his dad was sick. Obviously speaking, his dad was seen very differently when his son was advocating for him, because he wasn't just an old man with health problems, he was a father of family, et cetera, and there are people who are very concerned about him. You keep a notebook and journal. Now, this is a very particular issue. Remember, everything is, the purpose for the notebook or the journal is not so you have information about someone, because you don't actually own this information whatsoever. You're only doing this to help the person. So as a prime example, if the physician is saying that it seems that you're having this issue or that issue, or you should be taking 2 pills a day of this, or whatever it is, the person you're with, who you're representing, might be having some early dementia, as it's saying, and they might not remember everything properly. So therefore, the notebook, the journal is important, keeping the record of what's been said. But the other thing is then you can share that information with the person afterwards, because they might have forgotten. They might say, well, what did the doctor actually say about that problem? And you'd say, well, they actually said this, this, and this. or maybe they need they need some test that has to happen, and you think that after you heard about the test, that you're thinking that might be something that would be beneficial, because remember, we always want beneficial care. That would be beneficial for you. Then you can bring it up again, and you keep a folder of the written responses. So the doctor might give you some information, or the nurse practitioner give you some information. It's important to keep that in a folder for that person, and you keep everything together and sort of, so these semi-organized, so they know exactly what's going on, and you can prompt them and remind them. So taking notes, we must respect that person's privacy. We ask questions. So maybe the doctor or nurse practitioner saying, it appears you're having something develop this way, and that this is what appears to be going on. You ask questions because it's important that that this be clarified, that we know exactly what this is about. We can't be intimidated. When I said we have to be polite, and even to the point where it might be painful, that's exactly it. But don't be intimidated. Just because someone's a doctor or a nurse practitioner doesn't mean that they're God. It just means that they are a care provider, and it's important that we talk to them and we find out what's important for our person we're representing and we're advocating for. Suggest that they provide answers. You know what's important about this. Inquire about services. So are there services available for this? There might be other services that are in this community that don't exist in another community. Inquire about the services. So often a physician or nurse practitioner, especially if it's a medical clinic, will be well aware of certain services that exist in the community and what might be available for the person you're advocating for. Ask for information sheets. Well, you know, we know that Dr. Google has lots of information for us today, and we often want to refer to Dr. Google. But you know, the funny thing is physicians and nurses, they go to their computer, and if they're saying, "Oh, there seems to be a problem with this, there seems to be your person you're representing seems to have this condition," they will have information sheets about it, and you ask for those information sheets. Make follow-up appointments. Help fill prescriptions. So follow-up appointments. If the physician says to the person, we have to see you again in 6 weeks, then before you leave the office, you would say to the person who's making the appointments, we need to see you again in 6 weeks. What date would work best for the person who you're representing and for yourself? And you get the date and you make sure it's marked down, the time, the date, the information. Filling in any prescriptions is very important. There might be a prescription to fill. Discuss the appointment with the person. Now, that's the other advantage to having some notes. You're discussing the appointment with the person. You're saying, Mary, this is what Dr. So-and-so or the nurse practitioner said. So as an advocate, you're invaluable in helping make the world a better place for those in need, but you're helping someone receive the care that they deserve. You know, the interesting thing about advocacy is as the population gets older, there are people with more and more health conditions because we're living longer. Well, advocacy becomes even more important. The other thing is we don't have the same type of family unit as we once had. So therefore, you know, there might be someone with 3 or 4 children, but none of them live in their local community. Therefore, being an advocate for them is a great help. If it's someone you've known for years, that's another big advantage because you've known this person for years and years. You knew them when they were fully healthy, and now they've got these different health issues. You still know them, but now you're helping them by being an advocate for them. Now, this is not for everybody, but I will say, I'm going to go through this advocate's code of conduct together. I will practice with compassion and respect for the person with whom I work. My primary commitments are to promote the health, safety, and rights of the person you're representing. I will be transparent in my work with the person. I will maintain privacy on behalf of the person and keep confidential all activities and records. I will guide and assist the person in medical decision-making, but at no time will I make decisions about their health or medical care or medical services on their behalf. It's very important. Remember, you're helping that person receive the care that they need, but you know, unless that person's become incompetent and now you are their power of attorney, you're not making decisions on their behalf. You're helping them make decisions in a sense, but you're helping them receive the care they deserve. I will respect the person's values and belief system as the foundation of their decision making. Elder abuse and other problems. So here's the situation with elder abuse. It's become very common. I'm not suggesting in any way, shape, or form that when you go visit people, you're going to bump into people who are experiencing abuse. But if you consider the data on elder abuse, you're realizing that it's become a serious cultural problem. One of the reasons would be that people are living longer and they have more resources. So one of the realities is that you have a situation where you will have children in a family who might be very dependent on that person, and as that person gets older, they start to take advantage of them. And so, but you know, the problem with elder abuse, as we know, the data shows that most abuse occurs either by a family member or a friend. So there are other forms of abuse that are not connected to family members or friends. So, for instance, there might be somebody who's running, a fraud game and they call people up so that obviously the person doesn't know them, but they're claiming something in order to make that person give them money. These are kind of things that happen, but most abuse is happening by family members or friends, and this makes it very serious because people don't talk about it. You know, signs of abuse, sores or injuries. So if you're visiting someone and they consistently have injuries, now they might say to you they fell down or something like that. But if they're consistently having injuries and they don't have a proper explanation, like why do you constantly have injuries? Like, how do you ask them about this? But you're noticing that they have an injury on their arm, and the next time you come, they have an injury on their other arm, or they might have something happening where they have a cut. It looks like there's something else that happened. What's going on? That's a physical abuse issue, and you start feeling very uncomfortable with it. And at a certain point, you might need to talk to that person. I'm not in any way saying you're going to bump into this once again, but I'm saying that if you do, you need to know how you have to react to it, because you can't be silent about abuse. People not seeking care for an injury. So normally speaking, if you get hurt, let's say someone falls down and they actually do get seriously hurt, normally speaking, you would call the ambulance or find your way to the hospital or to the doctor because you have a serious injury and you want to make sure that it heals properly. But if they're not seeking care for it, then they might be covering up. How about someone who's become messy, unclean in appearance, meaning that they're not taking care of themselves? And if this is someone who always did take care of themselves and now they're not taking care of themselves, obviously speaking, that's a concern. Weight loss and malnutrition. Now, it's natural that someone might lose weight as they're getting older and that kind of thing, or if they become very inactive, they might actually gain weight. But I mean, if they're experiencing abuse, often they do experience weight loss. Sometimes they're experiencing abuse where the family member is constantly taking things from them. So why are they experiencing malnutrition? Because they don't have any food in the fridge. That their son or their daughter has come and is taking things from them all the time, and they might be out of money at the end of the month because they did their grocery shopping. It's all gone. They have nothing anymore. You hear about these things, you think, how could that be? Well, it does happen. Dehydration is a big sign of abuse. Dehydration, someone is experiencing, and what problems with dehydration? It leads to other health problems, because often when you become dehydrated, then you start losing your acuity, your mental acuity. You become very you're having difficulties, and that's a direct sign of dehydration. Someone's afraid of you. You come and you're just talking to them, you're being very kind, and then they react funny when you get up. Obviously speaking, then you have to think, well, what's happening? Financial fraud. Well, financial fraud, sadly, is the big crime of the 21st century. People are, and we're hearing about it all the time. It's sadly not uncommon. A lot of the elderly population have some resources. They might have sold their house for significant dollars, especially if they sold it last year, and they're being taken advantage of. And we're hearing these stories happening. And some of these fraud, exploitation sort of things that are happening are so well organized that as soon as someone sort of lets them into their life a bit, because they sort of are believing this story, they are falling into it. It seems like they're able to control you a bit because they have been trained to convince you that you're supposed to be following what they're suggesting. And then there could be signs of sexual abuse. Physical abuse is an act of violence that may result in pain, injury, impairment, or disease. Whereas neglect is the failure to provide the goods or services necessary for functioning or to avoid harm. So there's the physical abuse issue, there's neglect issues. Elder abuse, doctor or other healthcare providers not notified. That's very common for elder abuse. the wound is not being cared for, so you might get some infection. There's some, it's a bit smelly, it's dirty. If you notice someone experiencing these things, you have to wonder, why is this the case? Why are they not being properly cared for? Why are they not seeking the care? The person has not received medical care. Most common injuries are bruises, pressure sores, and fractures. Bruises obviously are quite common because someone who's being pushed or grabbed in a very heavy way. This is something that will cause bruising, especially much easier for an older person. Pressure sores. There's other issues around pressure sores. So you're not being moved properly, you're not being cared for properly. Fractures are related to falls, but also if someone was pushed over, someone's being not treated properly. Superficial injuries involving the outer layer of the skin. So you're seeing these injuries to their outer layer of their skin, and it's caused by the movement of the skin over a rough surface. So someone is grabbing them, they're pushing them, they're doing something to them, and you're seeing this like it's a bruising, it's an injury involving the outer layer. And if you're seeing it, it's common that this is something that they're experiencing on a regular basis when you visit them. So let's say you visit someone for half an hour every Thursday afternoon, and you've noticed that this is regularly seemingly a problem, then you have to start becoming concerned about it, and how to deal with it is not easy. So let's say you're part of a church community and you're visiting them on behalf of the church. It'd be very important then if there's somebody in the church who is also the one who's overseeing the program. So let's say there's a pastoral minister. Let's say it's being done through the Catholic Women's League, and there's a lady who's specifically doing it. When you're having serious concerns about abuse, you can't remain silent. You have to say, well, I think there's abuse here. And at some point, early on, someone has to start asking direct, polite, but direct questions to uncover the abuse. Bruises happen when the blood vessel ruptures and blood escapes into the surrounding tissue. It may suggest the cause of the injury, meaning there's certain spots, obviously, that you will notice if there's certain types of injuries. A common location of non-accidental injuries are the face and the neck. Okay. The results from burns result from tissues being heated above 50 degrees Celsius, and burns are categorized by the amount of surface area that is affected by the damage from the burn. But what's important here is that persons over 65 have double the national death rates due to burns. If you're over 75, it's triple the death rate, triple the rate of death for serious burns. And if they're over 85, quadruple the rate. So older people, obviously, the burn injury affects them greater, and they're more likely, if they have a serious burn, they're more likely to die than someone who's much younger who might have obviously damage to them, but nonetheless, they recover from their burn. Fractures occur when an external force greater than the strength of the bone is applied. Now, external force could be someone hitting them, could be someone slamming something against them. These are terrible things, but obviously, this is how it works. Older people are more susceptible as the result of a bone disease or injuries. Like an older person would have, how would you say, weaker bones also, so therefore they get affected more easily by they're more susceptible to this. But if you've got common injuries happening, such as the most common sites for an injury like this would be the hip or the wrist, then there could be issues around abuse. The problem is also if someone becomes very elderly, their bones start to become very weak, especially if they've had health problems. One of the problems with, for instance, cancer. So let's say someone had cancer and they went through treatment and then they recovered from cancer. Cancer is one of those diseases that really robs the bones of their bone density, of their strength. So they will often after that have difficulties with bones, breakage and things like that. Nonetheless, it's a sign, if it's happening regularly, that there's a sign of abuse. Blunt force lacerations. Well, it's characterized by the splitting of the skin, and it's common in physical abuse, but can also occur with neglect. Pressure sores. Now, here's the thing about pressure sores. The standard of care for pressure sores is prevention. The problem with the pressure sore, so a prime example, let's say somebody has lost certain mobility issues. Let's say they had a stroke and they're in bed and they're recovering from their stroke. People need to move around regularly. You can't just leave somebody in a position. You can't just leave. If let's say somebody else is in a situation where because they can't move around properly, etc., they might be soiling their clothes a bit. You can't just leave them in dirty, wet clothing and things like that and not move them around and not clean them. What happens is it results in pressure sores. The interesting thing is I was talking to someone more recently about this whole issue of pressure sores because they had a spouse who had for years needed care. This person had a serious stroke, and they needed care. They brought that person home. They were caring for them in the home. And the point is that they always watched out for the issue of pressure sores, moving that person, etc. Another prime example of pressure sores is a person on our board. He's in his 60s, but he in his 20s he had a serious accident, and so he's been in a wheelchair for over 40 years. And he's always pointing out, like if you talk to him and he's in a meeting, he's always moving around like this and that. And he says, I'm intentionally moving around because in the past I had some problems with pressure sores, and I know the way to avoid pressure sores is that movement. I have to keep moving. I can't stay in one place all the time. Standard of care for pressure sores is prevention. Okay. If you visit someone in the hospital and they've got all these pressure sores, what happens to them? They become infected. When you get infection, what happens? That creates serious pain, serious difficulties. Now you're giving them antibiotics. It sometimes, of course, leads to their death. Death from a pressure sore is not an uncommon situation. Sadly, it happens. So, of course, the point about pressure sores is that often may not be physical abuse that's occurring, but it's certainly neglect that is occurring. You can't allow someone to have a pressure sore. It has to be avoided. Abuse or neglect occurs when a person is restrained in a non-critical situation. So this issue of restraints, you might never bump into this because you're visiting people who are competent. You're visiting people who might be in their homes. Even if they're in a nursing home, for instance, they're almost always going to be competent or at least semi-competent. But what you're seeing in our culture is we still use restraints in our culture. I'm not sure if the Americans use them more or not, but I know that some countries have actually outlawed the use of restraints. And I actually think this makes sense because a human being is not an animal. Human beings might become very difficult if let's say someone has significant dementia. They might become very difficult to care for, etc. But just putting them in restraints and leaving them in order so we don't have to worry about them, to me, that is neglect. I think that's neglect. And as I say, some countries have outlawed the use of restraints, except for in the extreme circumstances. Okay, restraints are also strongly associated with increased injury or death, and it also is more likely going to result in worsening behaviors, not better behavior. Okay. Skin tears. Well, in sites other than arms or legs or multiple tears or abrasions should raise suspicion. As I mentioned before, skin tears do heal with scarring, but if you see this as a regular situation, a good sign. Sorry, it's a bad sign. It's a bad sign that abuse is occurring. Malnutrition. Malnutrition is a serious problem, especially for our elderly. With the increase of food costs, we're hearing even now the food banks are becoming more busy. Even though the unemployment rate in Canada is down, food banks are saying they're more busy. Why? Well, food prices have gone up. But even with the issue of malnutrition, people need to be properly cared for food. If someone's in a care home and they're being provided food that culturally they have no interest in eating, then that could be a problem. A lot of malnutrition issues are based, they'll accuse it as being not enough staff. But the funny thing is I do get calls from people regularly who go in and visit their family members, and they do that on a daily basis, or let's say a few times a week, because they might have a brother or a sister or a friend who's also going in to do the same thing. And they're feeding their mother or they're feeding their father, and they're doing this because, of course, staff in the institution is too busy to properly feed their loved one. So they're doing it themselves. During COVID, I wrote about this, and we know this also from the whole thing that happened in Quebec. Quebec had an inquiry about the COVID abuses that occurred in Quebec, and the malnutrition issue was absolutely insane. So what happened is in a lot of institutions, when COVID broke out, people were so afraid of COVID that they didn't go back to work. They didn't go back to the nursing home. And so what happened is, well, who was going to then feed the residents? There was a lot of people who died of malnutrition. And so when you start looking at the data on that, it's actually a horrific situation if you consider what actually happened to people. Nonetheless, and also the other thing is I got a call from someone who was so upset because they were one of the people who actually went in pretty much every day to feed their mother. And then when COVID happened, they weren't allowed to go in. Okay, then who's going to feed mom? You know, it was a serious problem. And you know, they talk about these deaths, what occurred. You know, I can't. You know, it's actually painful even to think about it. Okay, that's exactly the situation. Dehydration. Well, you know, one of the problems with dehydration, as I say, it leads to confusion, sleepiness, and everything. It also affects the absorption and the effect of the medications people are receiving. But you know, it's interesting. Someone might become dehydrated, and then they're always confused and everything. And then what's happening is some medical caregiver might then inappropriately or improperly diagnose that person as having dementia. Or saying that they now have signs of dementia and they changed the caregiving for that person, when in fact what was happening is they were dehydrated. And I think it's very important to understand how dehydrated we need hydration. You know, you can die very quickly without hydration. People tend to die between 7 and 14 days without hydration. If someone is already somewhat dehydrated, it might go a bit quicker. But you know, the fact of it is that once they are experiencing dehydration, then sometimes that is seen as something else, and then they never properly hydrate the person. It's interesting that if someone is experiencing dehydration and then they hook an IV to them to hydrate them, often that person comes right out of it. They almost like come to a point where they were almost like they were before. So, you know, this is the kind of thing that does occur. People with dementia, well, may not recognize that they are being abused. Someone with dementia just, you know, and they may not be able to report it. And if someone does report the abuse, it may not be believed. This is a serious problem. So we must remember this, especially if we're talking about family members or friends who we know who have dementia, and then there's signs of abuse. Sadly, now, like I'm going on about this, and this is sort of a side topic, but sadly, we've seen some stories on the news where family members put a camera in the room, and then they were able to identify the abuse because there was a camera in the room. That should never have happened. First of all, it shouldn't be necessary. But if it is necessary, now there's all these legal issues around privacy and things like that that start coming up, when in fact all the person was trying to do is protect their mother or their family member or their friend. Self-neglect. Well, when someone's experiencing abuse, then it often leads to self-neglect. Neglect. Someone feels that they deserved it, right? The victim becomes more vulnerable. Often the victim is dependent on the other person already anyway, but abuse often then leads to self-neglect. You know, someone might be experiencing dementia, or it causes them to have dementia come onto them much quicker because of this abuse that's happening to them. They often will then lead to some mental health problems because they feel they are the ones who are the problem. They're wondering, why is my son doing this to me? I must be the problem. And sadly, as I say, often it's because the person who's being abused is dependent in some way on the abuser, meaning it's a family member, etc. There is a situation I knew very well of family members who were really taking advantage of their father, and it was quite serious, and it very much upset me. And I was doing some advocacy for this person, and the problem is the man who I identified as being abused. I would talk to him about it. I was helping him in every way I can. He did not in any way want there to be a situation where he didn't see his family. even though his family were the ones who were financially taking things from him and taking advantage of him. But of course, he wanted to see his family, and that's normal. That's a normal reality. It made it a very difficult situation. Interesting thing is when I I talked to the police about it, and they said, "Oh, yeah, well, we've already got a file on this. Do you want us to investigate this further?" And I'm like, yeah, I think you might need to investigate this further. But they already had a file on it because I wasn't the first to put in a complaint about this. Abuse or neglect leads to depression. Well, you can understand that. It also leads to self-neglect, as I've mentioned. Alcohol abuse. 5% of older persons have alcohol abuse. I'm not sure if that's just to older persons or, I'm not sure exactly what percentage of the population experiences alcohol abuse in general. It's more common in men than women, and lower levels. And when you are older, it takes less alcohol to feel the ill effects, right? Because people's bodies change as they get older. The interesting thing is during COVID, a lot of people then experienced a lot more, not only alcohol abuse, but drug abuse. Financial abuse. Well, this is the crime of the 21st century. Widowers in their 70s, 80s, they're being taken advantage of. It's very common. You can start Googling the stories, and sadly, how do you protect someone from this? Well, sometimes it's very difficult to protect someone from this because they often buy right into that story. They're getting a phone call from somebody, or they've been contacted by some company. They're believing that they're helping someone. They're believing that this is exactly what they need to do. They've been asked, and it often starts small. They've been asked for, oh, well, can you help us? Can you help so and so with this? We need $800, and they're thinking, oh, I'm going to help somebody. I can do that. I can give you $800. And of course, there's this whole story, and they've bought into the story, and it's been sold to them and everything, right? And so that's the situation. And then it goes further and further and further. Once they have you, they reel you in. It's a terrible situation. Compassionate Community Care. Here's our information. It's a charity. So any donations to Compassionate Community Care receive a charitable receipt. We not only offer these training sessions, but as I say, there's the advocacy program that will be coming up very soon. There's also the helpline that goes on, and the helpline regularly receives phone calls from people. And people, often the helpline deals with healthcare issues, meaning someone's concerned about the healthcare that someone's been receiving. But lately, it's more about euthanasia and assisted suicide. Somebody will call and they'll say a friend of theirs who just got a call the other day, sadly, about I just got a call the other day from somebody, and it was not someone they actually knew, but it was a friend of theirs who was going to die by euthanasia, and they were calling to ask about, well, how do we deal with this? How do we, I've known this friend for many years who's saying that his father, it was a relation of his friend, right? And he was talking to me about it. Of course, I made it very clear that he's got to talk to that person who he knows, because that's the person he has some effect with. Kathy.
Yes. So thank you all for joining us this evening. If you have any questions, please definitely reach out. Our charity does operate on the generosity of donors and people who back our work, financially speaking. So all donations will receive a tax receipt, especially if you're in Canada. And you can, contact us at this address here, 383 Horton Street East, London, Ontario. And if you'd like to reach us, you can call our phone number. We have a phone number which is not listed here, but I can put it in the chat, so everyone can reach out to us that way, and you'll get us directly. So if you'd like to make a donation to support our work, you can do so through the phone, online, on our website, beingwith.org or compassionatecommunitycare.org, and simply put any receipt will receive a tax donation. So thank you all for joining us. If you have any further questions, feel free to reach out. We definitely would love to stay in touch with you. So after this event tonight, you'll get a link to actually do a quick survey for us. And like Alex said, we're preparing an advocacy training as well, which you'll be alerted to once that's ready and available. And if you have friends, family that would like to join us in this kind of, this seminar, Being With, we're hosting another one in August, which will be the 3rd and 4th of August as well. please encourage them to join us for that. And definitely do stay in touch. We're on Facebook and on Instagram. So you can find us at Compassion Community Care Online. And if you need or happen to
Lost for
do, sorry, go ahead, Alex.
the book
Yep.
got lost in the
Yeah.
background.
Thanks. If you need a copy of this book, which is the Being With manual, the workbook, or the training manual, which we covered the material today, but you can have it as a good rate review, feel free to reach out to me and send us a message on email, or you can call us even. And that way you will have a copy for yourself. And you can get as many as you need, of course, for yourself and for your group. And if you'd like to, definitely encourage your groups to participate in the upcoming trainings, because the more people that know about this and do this training, the more are able to go out and help others. So definitely do that.
Are there any questions too?
Yes.
If you can ask questions. I'm going to say something again. That last section, elder abuse, issues around elder abuse, it becomes very difficult to talk about because it is a reality. And you know, and I said to you, you're visiting people who are competent, etc. You might never ever, you know, bump into someone who there's signs of abuse. But it's important to know about these things, because if there is signs of abuse, we can't stay silent, and that becomes the difficulty, right? So it's important that we know about it, that we're aware, because if you start seeing something, then you have to say something about it. And if you're representing, so let's say it as a prime example. So let's say your church community is now saying, yes, we're going to be involved with Being With, we're going to do visiting, and so this is the training we're going to be offering, etc. And then obviously Compassionate Community Care will offer that training. You know, now you're identifying somebody in that community. We don't always know. It's difficult, isn't it? We don't always know, but there's signs of suspicion that stand out, and we're thinking, this is too problematic. So obviously, you know, being polite and caring, but asking some questions, but then sometimes you might have to speak to somebody and say, I'm just thinking that there's a cover up here of what's happening, and so needs support somehow because there appears to be abuse. So